Here's from the Mental Health Liaison Group. In the midst of our nation's ongoing mental health crisis. I'm going to
just for 1 second. He is filibustering to protest the Trump executive orders and bad bills that are wreaking havoc on society.
Where someone didn't want to stand up and tell me about the mental health crisis in America and how poorly we were doing. And so when he writes off, when the Mental Health Liaison Group starts off with that, it hits me very hard. I still remember meeting with a guy in a New Jersey diner who had mental health issues, was a teacher at a high school, and stabilized his mental health because of his prescription drugs, but then stopped being able to afford them, started skimping on the drugs, had a mental health crisis, lost his job, and his whole life destabilized. Just because of not access to a costly prescription drug. A valued teacher had his life upended. So I start this letter again. In the midst of our nation's ongoing mental health crisis, including its devastating impact on youth, and our ongoing overdose epidemic, it is paramount that access to life-saving MHSUD services is not reduced, and the integrity of the Medicaid program to serve as a vital federal and state partnered safety net is preserved. Limiting access to Medicaid threatens to undermine gains in reducing overdose mortality rates and could lead to increasing rates of incarceration and hospitalization. And my colleague from Delaware knows this. The biggest mental health institutions in America, the biggest ones, pick your state, from Illinois to Los Angeles, the biggest mental health institutions are LA prisons, are Chicago's prisons, prisons and jails. Wasting taxpayer dollars where folks got their mental health care treatment, their lives could stabilize. They could be workers. They could be helpers. They could not be sick. Here's Chip Kahn, the CEO of Federation of American Hospitals. In quotes, key Republican lawmakers recognizing that so many constituents rely on Medicaid for official care, for critical care, made it clear that their vote today was based on an understanding that the final reconciliation bill would not include devastating cuts or changes. I believe that's gratifying, Chip Kahn writes. It is important that these members came to the same conclusion. Medicaid cuts should be off the table. Medicaid cuts should be off the table. It is up to these lawmakers to follow through and ensure spending cuts don't come at the expense of care for over 70 million Americans, including kids, seniors, and hardworking families. I love the appeal in that letter because it was an appeal that I'm reminded of that my colleagues Lisa Murkowski and the great John McCain and no Medicaid cuts. No Medicaid cuts. I know President Trump has said that. Medicaid cuts are off the table. Said that over and over and over again. We'll see. We'll see. Modern Medical Alliance, with over 70 million children, seniors, and hardworking families relying on Medicaid for their health and well-being, it is critical Congress listens to state and local government officials, faith leaders, healthcare providers, and hardworking Americans, and blocks proposed cuts to the program. As organizations representing and caring for the millions of Americans who receive coverage and benefits through Medicaid, we know firsthand how the current level of cuts being considered by Congress would impact their care. They will cause Americans to lose coverage, reduce health access, and increase costs. We oppose any cuts. We oppose any cuts. We oppose any cuts or harmful policy changes to Americans' Medicaid benefits as part of the budget reconciliation process, and call on congressional leaders to reverse course and protect the program moving forward. Here's the Modern Medicaid Alliance. The latest House vote breaks a vital promise to more than 70 million Americans who depend on the Medicaid program and now face the potential for unprecedented destabilizing cuts to their coverage and access to care. The full extent of cuts being considered go far beyond addressing waste, fraud, and abuse and would undermine Medicaid coverage for those who depend on it. Already, senators are issuing stark warnings about the impact of Medicaid cuts on the stability of their communities, state budgets, hospitals, and providers. We urge members of the House and Senate to block any Medicaid cuts or harmful policy proposals as part of the ongoing budget process. Sister Mary Haddad, President and CEO of Catholic Health Association. We are deeply concerned that the budget resolution would force the House Energy and Commerce Committee to slash $880 billion from the Medicaid program, an essential healthcare program for nearly 80 million low-income Americans. Medicaid provides coverage for 1 in 5 individuals, funds 41% of all national births, and is the largest payer for long-term care and behavioral health services. These cuts would have devastating consequences, particularly for those in small towns and rural communities, where Medicaid is often the primary source of health coverage.
Yep.
Medicaid is not just a health program, it is a lifeline. It provides access to care for those who need it most: poor and vulnerable children, pregnant women, elderly, adults, and disabled individuals in our nation, while ensuring their dignity. Their dignity. Here's the Partnership for Medicaid again. The Partnership for Medicaid, a nonpartisan, nationwide organization representing clinicians, healthcare providers, safety net health plans, and counties, calls on Congress to reject cuts to Medicaid during the budget reconciliation process. The Partnership for Medicaid stands ready to work with policymakers to identify more sustainable strategies to strengthen Medicaid and improve upon its promise of providing high-quality coverage and access to care populations. Another organization saying, hey, put me in. Let us help you improve this program, and maybe we can achieve some of our mutual goals. Here is Dr. Susan Cressley, President of the American Association of Pediatrics, the great AAP. The American Academy of Pediatrics urges lawmakers to reject the budget resolution before the U.S. House of Representatives and to protect programs that are vital to the health and well-being of children. We oppose the proposed funding cuts to programs like Medicaid and the Children's Health Insurance Program, which cover nearly half of all U.S. children, as well as the Supplemental Nutrition Assistance Program. These cuts would have devastating consequences for children and families. We're going to talk about cuts to SNAP later, but I love how Dr. Susan Cressley, President of the American Association of Pediatrics, can't help but mention them together. Why is a doctor concerned about healthcare also mentioning SNAP? Well, fundamental to our children's health and well-being is having access to fresh and healthy foods. Yep. This is me being a little critical of people saying their MAHA, Make America Healthy Again, and then immediately cutting kids' access to fresh, healthy fruits and vegetables. I love this doctor. It's almost like you're doubling down on the injury to our children. We're cheapening highly processed and sugar-filled, empty, nutritious foods, denying access to fresh, healthy fruits and vegetables, and then not letting people with chronic diseases get health care. I love this doctor for pointing out those connections. But now I'm going to go to Brian Connell, who is a vice president of the Leukemia and Lymphoma Society. The fiscal year 25 budget resolution would create not just the opportunity by the obligation for the House committee on energy and commerce to make dangerous cuts to Medicaid program in the budget reconciliation process expected in the coming week, the hundreds of billions of dollars cuts demanded by the budget resolution cannot be achieved without slashing benefits for enrollees or altogether taking away Medicaid coverage for millions of Americans. To be clear, the Leukemia and Lymphoma Society and the patients we represent are clamoring for Congress to lower healthcare costs. But the framework before the House today would pave the way for policies that do just the opposite, putting affordable access to healthcare out of reach of millions of Americans. Feeding America, I love this organization, cuts to vital federal nutrition programs like SNAP, necessitated by this resolution and the Senate version passed last week, will make families grappling with high food costs, hurt rural economies, and strain food banks already overwhelmed by the rising demand.
Here it is,
We
folks.
urge the House to reject
Cory
spending
Booker,
cuts
make
to
him
nutrition
trend.
programs in the budget reconciliation
Make him
process
trend.
and support the work the House and Senate agricultural committees are doing to create a strong bipartisan farm bill. The Federal AIDS Policy Partnership we are writing on behalf of 95 national, regional, and local organizations advocating for federal funding legislation and policy to end the HIV epidemic in the United States. We urge Congress to reject all proposals to enact cuts to Medicaid, whether through per capita caps or block grants, restrictions to the federal Medi-Cal assistance percentage, or FMAP, or mandatory work requirements during reconciliation for the 2025-2026 fiscal year budgets. Medicaid is the most important source of health coverage and life-saving care for people living with HIV. The most important source of health coverage and life-saving care for people living with HIV. Providing coverage for more than 40% of the people living with HIV and contributing 45% of all federal funding for domestic HIV care and treatment.
Cory Booker's going to go on for as long as he can. So
The next letter starts. To be clear, the cuts outlined above are being proposed for one simple reason: to pay for $4.5 trillion in tax breaks that disproportionately benefit the wealthy. Congress can and must take a different path. Congress must take a different path, one that lifts more families out of poverty and provides more Americans with the opportunity to reach their full potential.
Thank you.
A people-first agenda should include expanding the child tax credit for the 17 million children who don't receive the full credit due to low family incomes, expanding rental assistance, increasing SNAP benefits to reflect rising grocery prices, and closing the Medicaid coverage gap. If Congress focused on ensuring that wealthy Americans pay their fair share rather than providing additional tax breaks, we can fund these initiatives and so much more. This is a group of groups that you'll recognize, or many people will recognize: American Association of Nurse Practitioners, Gerontological Advanced Practice Nurses, the Association of National Nurse Practitioners in Women's Health, National Association of Pediatric Nurse Practitioners, the National Organization of Nurse Practitioners Faculties.
Folks, if you're wondering why he's doing it, says,
We are deeply concerned with the impact of these cuts
Donald Trump
on the healthcare system and their potential to harm our most vulnerable patients. Further, these cuts will threaten the viability of practices that treat Medicaid patients, financially destabilizing and having a disproportionate impact on those who provide care to underserved and rural communities. Association of American Medical Colleges, AAMC. We remain extremely concerned that the budget resolution's reconciliation instructions would result in unsustainable cuts to federal health care programs, specifically Medicaid, by requiring at least $880 billion in savings from the House Energy and Commerce Committee. Cuts of this magnitude would jeopardize both access to care for millions of Medicaid enrollees and the financial stability of the providers who care for them. Here's one from Chimes International, or Chimes International, forgive me, Chimes. Cuts in Medicaid will have a dramatic negative impact on our healthcare system and the first responder community. Millions of Americans will be at risk of losing access to housing, thereby increasing homelessness for some of the most vulnerable members of society, especially in areas that already lack affordable housing. Provider organizations like ours will be forced to close the doors of residential facilities and reduce support staff, which is already in short supply. Katie Smith Sloan, who is the president and CEO of Leading Age, states would have to fill in massive budget holes if federal funding to Medicaid programs were cut. Even if a cut, such as the change to the expansion FMAP proposal, does not seem to directly impact aging services, it would, because the cost of the cut would have to somehow be absorbed by state budgets. That type of hole cannot be filled in via more efficiency. Balancing the 10-year program budget cycle on the back of Medicaid program is not a good trade-off for the American people. Alan Morgan, who is the CEO of the National Rural Health Association, this letter is powerful. He represents the National Rural Health Association. Any cuts to the Medicaid program will disproportionately affect rural communities. Rural Americans rely on Medicaid coverage, with about 20% of non-elderly adults and 40% of children living in rural areas enrolled in Medicaid and CHIP. In almost all states, rural areas have higher rates of Medicaid enrollment than metropolitan areas. Cuts to Medicaid would shift healthcare costs onto rural families,
Yeah, that's right.
many of whom already struggle
That's right.
with financial instability. Medicaid cuts would force families to face higher out-of-pocket expenses, leading many to delay or forego necessary treatments. The burden would worsen health outcomes, especially for those managing chronic conditions like diabetes, heart disease, and cancer.
Yeah.
To the extraordinary prescience of my colleague from Delaware, who knew this letter was coming, I imagine. This is a letter from the U.S. Conference of Mayors, the National League of Cities, the National Association of Counties, the National Conference of State Legislators, the Council of State Governments, the International City County Management Association. I'm going to pause for a second just to remind folks, because I've been involved in the U.S. Conference of Mayors, National League of Cities. I've dealt with the National Association of Counties on things that were important here in the Senate. All of these groups are bipartisan.
Yeah, that's right.
All of these groups represent Democrat and Republican mayors, Democrat and Republican city council people. I was actually nonpartisan mayor. Newark does not have partisan elections. So they have nonpartisan folks. This is a group of people who have those jobs where the rubber meets the road.
Yep.
A change in state policy, a change in federal policy, we had to eat it when I was mayor. If it cost us more money. I was a mayor that talked like lots of mayors do, not in partisan lingo. They just talk about, hey, it's an unfunded mandate. Hey, that's adding more bureaucracy. Hey, that's going to cause more people in my community to be homeless.
2 hours.
It's going to cause more children in my community to use an emergency room as their primary care physician.
He's been going on for 2 hours so far.
When I meet a mayor, I look at them and I thank them, because it's one of the hardest jobs in America. So this organization that represents Democrats and Republicans, they write, as a coalition of bipartisan membership organizations representing state legislators, mayors, cities, and counties, We are committed to working collaboratively to strengthen the Medicaid program so that the states and localities can continue to meet the needs of their residents effectively. We write to express concern over proposed changes to Medicaid financing and requirements that could significantly impact states and disabled, cause havoc to hospitals and businesses, cause havoc to rural communities, cause havoc to the idea of what it means to be an American. That we take care of our own, that we stand up for each other, that we lend a hand, that we lift folks up. And here it is, this voice of bipartisan sensibility that says, hey, hold a hearing, we'll come. Put some of us on a commission. This group that is called Advocates for Community Health. Medicaid successes as a national program derives from its variations across different states doing things in different ways. Medicaid looks different in every state and territory because the program is able to reflect and accommodate the specific needs of the state's patients, providers, and communities. These state-based programs are vital to the patients served by community health centers, patient-directed primary care providers that serve rural and underserved communities nationwide. As the House and Senate work towards a budget reconciliation package, Advocates for Community Health encourages a cautious approach to changes to Medicaid policy, as broad changes have the potential to destabilize state Medicaid programs and community health centers, impact local economies and job creation, and further exacerbate rural health care access challenges. The Families USA, their executive director, his name is Anthony Wright. Americans are storming town halls, calling their representatives in Congress and demanding that House Republicans stop their plan to massively cut the health care that Americans want and need. President Trump and some Republicans have said they won't touch Medicaid. But their vote today is when we see who walks the walk. The vote is the walk the plank moment for moderates who say they don't want Medicaid cuts, but are being asked to cut over $880 billion to the care and coverage of their constituents. Policymakers and public alike understand that there is no version of this budget resolution that does not include deep cuts to vital programs, services, and benefits the American people use every day to help them see a doctor, pay rent, or feed their families. Justice in Aging, it's an organization that's led by its executive director, Kevin Prindiville. He writes, with this vote, lawmakers endorsed taking away Medicaid from millions of Americans, including older adults, all to bankroll tax cuts for the wealthy. Thanks to our collective advocacy, the vote to pass this dangerous budget blueprint did not come easily. And we will make sure lawmakers know that voting to enact these cuts would be voting to abandon older Americans. The National Alliance for Caregiving. The House budget blueprint to eliminate at least $800 billion in federal funding, near funding unfairly targets criminal health care and supportive services that older adults, people with diabetes, and their family caregivers depend upon to maintain health and economic security for families and themselves. Home and community-based services funded via Medicaid are cost-effective. They save millions of taxpayer dollars on unnecessary and often unwanted institutional care. Most of all, Medicaid-funded HCBS, home and community-based services, offers consumers a choice in how they receive care, in the dignity of their own homes. In the dignity of their own homes.
Must be a quarter mile down the street.
Dignity.
Just, you know.
No, you can't do that to people.
No.
The Coalition for Whole Health Legal Action Center. Among the options being discussed are work requirements for enrollees, despite the fact that most people receiving Medicaid do work, and other cuts to federal funding that would disproportionately harm people with substance abuse and mental health conditions, and those with arrest and conviction records by making it harder to access critical health coverage and service, medications, and supports. Such individuals already face pervasive stigma and discrimination, including significant barriers to employment that threaten their stability and well-being. At a time when overdose and suicide are claiming more than 400 lives a day, we cannot afford to reduce access to comprehensive healthcare services that people with substance abuse use, mental health conditions, and those rebuilding their lives after incarceration desperately need to recover and thrive.
Yep.
So let me tell you something about that really strikes me. I was blessed to go to colleges, and there people would use drugs. And now I live in a community where the consequences for drug use often means jail time. In fact, if you look at low-income people, their chances of being incarcerated are far greater than college kids who have drug usage rates at about the same.
Yep.
And so now you say to somebody who's got an arrest record, serve some time, that when they come out, they can't get help? Or people with mental illness are over-incarcerated, and you're going to say to them, you got this mental illness, now you've got a record, and you also can't get healthcare services? That's again, self-defeatist when it comes to our nation trying to give people ways of elevating themselves above their past mistakes or the diseases that challenge them.
It's insane, Senator.
Here's another group, Community Catalyst. These cuts will hit hardest where healthcare access is already fragile. Here's the Alliance for Aging Research. We, the undersigned organizations, urge you to oppose any cuts to Medicaid and the Supplemental Nutrition Assistance Program, SNAP, including those called for in the proposed budget resolution. We are concerned about the negative impact these deep cuts will have on the Americans living with chronic disease and other disabilities.
Open this for me.
But we are willing to draw your attention now to how devastating they will be on those with Alzheimer's
Thank you. Thank you.
and related diseases,
Thank you.
including frontotemporal degeneration and Lewy body dementia and their family caregivers. April Barrett, president of SEIU. Let's be clear, Americans have flooded congressional phone lines, rallied at town halls, and lifted their voices to make it clear that they do not want massive cuts to the healthcare and public services they depend on. Despite that, today Speaker Johnson pressed a budget resolution forward that puts our nation on a disastrous path to ripping away healthcare from 80 million children, pregnant women, veterans, seniors, people with disabilities by gutting Medicaid. Lee Sounder, the president of AFSCME, this budget proves that extremists are more concerned with giving wealthy trillions in tax cuts than helping working people. Voters across the country are packing town halls to demand no cuts to Medicaid and SNAP. They're calling representatives asking them, please, save these services. They want their elected leaders who will lower rising costs, who will make it easier to afford rent and food. But instead of listening to workers, the House moved forward on a budget plan that will cause millions to lose their health care, increasing food insecurity for families, and jeopardize Medicare and Social Security in the long term. He calls this shameful. The Diabetes Leadership Council and Diabetes Patient Advocacy Coalition. We are deeply concerned about the budget resolution passed in the House of Representatives this week This budget resolution will likely lead to cuts to the safety net Medicaid programs, which provides health insurance to almost 80 million Americans, including children, pregnant women, elderly adults, people with diabetes, and low-income adults and families. This action would disproportionately impact Americans who most need us, including those with diabetes or other chronic conditions who rely on Medicaid to access medications and technology that they need to manage their conditions. Members of Congress should instead work to ensure access to health insurance. Through the Medicare program, work to ensure access to health care without barriers for the most vulnerable Americans. Here's the Alliance for Childhood Cancer. Work requirements may also impact caregivers of children with cancer who are unable to work due to the demands of cancer treatment for young adults with cancer who may not be eligible for insurance via their employer or may not be able to work due to their diagnosis. Many young adults rely on Medicaid, especially the Medicaid expansion for coverage, and research shows a clear increase in survival for young adults with cancer in Medicaid expansion states. Unidos US. The proposed resolution would slash at least $880 billion from programs that have long provided life-saving, affordable coverage to millions of Americans. Medicaid alone serves 80 million people, covering nearly 40 million children, half of those with special healthcare needs, and more than 40% of all births. In Latino communities, Medicaid reaches 20 million individuals, protecting nearly 1/3 of community members, more than half of Latino children, and roughly 30% of Hispanic elders. Without these vital programs, there'll be higher hospitalization rates, delayed diagnoses, and increased mortality. This would become the norm, placing an unsustainable strain on public health and national financial security. As Unidos US recently pointed out, these proposed cuts would represent the largest cuts to Medicaid in U.S. history.
Is this the Moss thing?
The Coalition of Survivors of Domestic Violence and Sexual Assault. On behalf of the adult and child survivors of domestic violence and sexual assault, we serve and advocate for them. We, on behalf of them, write to ask you to reject cuts to federal Medicaid funding. Survivors rely on Medicaid every day to escape abuse, to rebuild their lives after violence, to care for their children and families. Catholic Health Association of the United States and the United States Conference of Catholic Bishops and Catholic Charities USA. Weakening Medicaid through structural challenges such as per capita caps or block grants would undermine these values and risk leaving millions without access to essential health services. Furthermore, policies like work reporting requirements have shown clear evidence of creating artificial barriers to care, generating paperwork and bureaucracy while doing little to support people looking for work.
Yep, that's right.
These requirements also fail to recognize that most people on Medicaid already work and ignore the realities of low-wage workers. Caregiving responsibilities, health limitations, and studies have shown they frequently result in loss of coverage for eligible individuals and children.
That's right.
The Disability and Aging Collaborative and the Consortium for Constituents with Disabilities, on behalf of 107 national organizations and more than 230 state and local organizations. The undersigned members of the Disability and Aging Collaborative the Health and Long-Term Service and Support Task Forces of the Consortium for Constituents with Disabilities and allied organizations right to urge you to exclude Medicaid cuts, work requirements, or any changes that limit funding or eligibility from budget reconciliation or other legislation. People with disabilities, older adults, family caregivers and their children, direct care workers, and other low-income individuals and families depend on Medicaid every day for their health, safety, and independence. Medicaid enables our communities to go to work and to care for loved ones. It is our community's lifeline,
I'm getting my mail.
Oh,
and we cannot afford
Okay. All right.
for any part of it to be cut.
Hey, folks, I'm going to let this go here because I've got to
The
run an
Jesuit
errand.
Conference.
Keep watching
Programs
it.
that meet basic
So
needs,
MSNBC
such as
TV.
SNAP, Medicare,
YouTube.
and Medicaid,
Yeah.
health insurance, premium tax credits, and Social Security should be protected and remain as robust as possible. We oppose modifications that would have the effect of reducing important benefits or excluding vulnerable people from participating. Thank you, the Jesuit Conference. Why?
Okay, I've got to leave this one right now, but
I
keep
mean,
watching it on
we have just
MSNBC.
read
I'll see you, folks. All right.
dozens and dozens of letters from real people who are relying on these programs to